Well, welcome to the 700 Club. Today we start with a very sad story, a deadly tragedy in Israel. At least 44 people were killed in a stampede at a religious festival, and dozens more were injured. It was one of the worst civilian disasters in Israel's history.
A spokesman for the rescue service said, "In one moment, we went from a happy event to an immense tragedy." Prime Minister Benjamin Netanyahu has declared Sunday a day of national mourning. Chris Mitchell brings us the story from Jerusalem.
The tragedy occurred when a stampede began at the festival of Lag BaOmer, a Jewish holiday honoring a rabbi and mystic from the 2nd century who was buried on Mount Meron in northern Israel. The disaster was apparently caused by overcrowding, with large numbers together in a narrow passage.
We saw people pushing over the other, and slowly we saw people being trampled. At this point, when I saw the people, I started to go outside. There, we saw evacuating people every moment and conducting CPR.
It was the first religious gathering of its size to be held legally since Israel lifted nearly all restrictions from the COVID pandemic.
Absolutely difficult sights. I'm about 10 years a paramedic, and I don't remember I've seen sights like these. We are in a mass casualty incident. I see here tens of people laying on the floor. I see here tens of injured, walking and bleeding. I see here children and adults. Very difficult sights.
The Israeli military came in to help evacuate the wounded. Officials estimate 100,000 mostly ultra-Orthodox Jews gathered to celebrate the festival. Large crowds traditionally light bonfires, pray, and dance as part of the celebrations. Prime Minister Benjamin Netanyahu visited the site and earlier had called it a great tragedy. The stampede is likely to have a political impact as well. Netanyahu needs the support of his longtime allies, the ultra-Orthodox, to maintain any hopes he might have of staying in power. Today, efforts are underway to identify the victims and connect families with missing relatives. Authorities will be searching for answers. As Netanyahu said, everyone will be praying for the victims. Chris Mitchell, CBN News, Jerusalem.
Well, it's a terrible tragedy, and it's underlined by what they were celebrating. Lag BaOmer Lag is 33 in Hebrew, so they're counting the Omer, and the counting of the Omer is from Passover to Shavuot, what we call Pentecost. So it's counting the number of days, and it's 50 days for Pentecost means 50. Between the Passover celebration and then the giving of the Torah at Mount Sinai. This 33-day celebration was intended to honor a rabbi from the 2nd century, but it was also intended to honor the breaking of a plague. So the celebration with 100,000 people coming out as the first time you can have a public gathering after the COVID pandemic, they were celebrating the end of the plague. What happened was the crowd was dispersing and they were being funneled through a narrow corridor that was a series of stone steps leading down to metal. And it got wet and literally people slipped. And the report is there was an avalanche of people down these stairs and into this narrow passageway, which caused panic. It's a horrible tragedy, and underlining that, well, this pandemic isn't really over. And let's go to India for proof that it's exploding there. Today, the health ministry reported nearly 3,500 more deaths and more than 386,000 new cases. The situation is now desperate. Hospitals shutting down amid a critical shortage of ventilators and oxygen. George Thomas has that story.
At New Delhi's international airport, planes from the U.S., Russia and U.K. loaded with desperately needed medical equipment and supplies arrived in the country.
The situation is critical right now. This pandemic is the worst we have ever seen till now.
At least 200,000 have died so far, though experts believe the actual number could be much higher. Preeti Chowdhury heads up CBN's office in New Delhi, India.
The numbers, whatever it is that you've got out there, are probably being underreported because right now people are fighting even to to say goodbye to their dead. And really, it's like a wildfire, and we are overwhelmed. I think the system is overwhelmed.
India's healthcare system on the brink of collapse as the virus tears through dense cities like Delhi and Mumbai and scores of rural towns and villages.
The healthcare system has collapsed around us. Hospitals have shut their gates. Places are running out of medical oxygen. There's no ventilators to spare. Medicine has run short, and so many people are desperate to get help.
Tempers boiling over at this market in New Delhi as hundreds of people haggle over the price of oxygen. With hospitals running on empty, black markets in oxygen have sprung up around the country.
In every shop, there is no oxygen. There is no oxygen. When you go to hospital, there is no oxygen in hospital.
With the surge in deaths, crematoriums like this one in the capital city struggling to keep up as the bodies pile up.
So many people are dying and are brought here. Daily, at least 250 to 300 bodies are brought here. We see it.
And when the crematoriums run out of space, new makeshift ones pop up. At this open park in Bengaluru, one of India's key IT capitals, lines of ambulances waiting to drop off dead COVID victims.
They're setting up sites next to the official cremation grounds in empty lots and parking lots and parks. And they're lighting on fire dozens of bodies at once.
India's President Narendra Modi under fire for his handling of the virus and the vaccination drive. India is the world's largest producer of vaccines, yet only 2% of the country's 1.3 billion people have been fully vaccinated. And now, as the loss of life increases by the day, the United States, along with 40 other countries, rushing personal protective equipment and other medical supplies to help fight the devastating crisis. George Thomas, CBN News.
Well, this story should underline for all of us that the pandemic is not over. And when you see this kind of explosion of cases in a country, the devastation on the health system, the devastation in terms of people, just not being able to do anything. And then for the people that are infected, not being able to get proper treatment, not being able to get hospitalized, not being able to get the oxygen necessary to live. It is an ongoing tragedy. But here, for us living in the United States, for people living outside of India, be of concern, because the rise in these cases also means the rise in variants. The virus will have a new opportunity to mutate. We've already seen mutations, particularly the one from South Africa, that the current vaccinations, they're not sure if it's effective against that variant. So to see this kind of explosion in cases should be of great concern to everyone. Let's do whatever we can to rush vaccinations to India, to rush the needed healthcare equipment. This pandemic has to come under control throughout the world. It's not sufficient for it to be supposedly under control here in the United States. We need to have it under control around the world, because these variants will travel around the world. Well, back to the U.S., vaccinations are up, new COVID cases are down. John Jessup has that story from our CBN News Bureau in Washington. John?
Thanks, Gordon. With around a third of the population now fully vaccinated, more than half of the states have seen a significant decline in new cases. The trend is down from the higher levels from 2 weeks ago, and soon the Food and Drug Administration is expected to expand the Pfizer vaccine for kids ages 12 to 15. One major sign of the improving conditions, New York City, once the epicenter of COVID cases, is preparing to reopen completely starting July 1st.
You've gone out, you've gotten vaccinated, you've done so much to fight through this crisis. Now we can see that light at the end of the tunnel.
The economy is getting a huge shot in the arm as well from the end of the COVID lockdowns and the reopening of businesses. The government's current estimate shows it growing at a powerful annual rate of nearly 6.5%. The economy could have its strongest year since the Reagan administration back in 1984. Well, although COVID is on the decline, it has taken the lives of more than 500,000 people, nearly 200,000 of those in nursing homes. The Biden administration has a plan it hopes will keep people out of nursing homes and instead allow them to get the care they need right where they are already living. But as CBN's Lori Johnson explains, not everyone is on board.
1/5 of President Biden's $2 trillion infrastructure package would go toward providing home care to the very poor and the disabled who qualify for Medicaid. That's a price tag of $400 billion. While Medicaid already covers both nursing home and in-home care, there's a sticking point in the form of an average 3-year waiting list for in-home care. That means people who can't wait that long end up in nursing homes. The Biden plan aims to change that by increasing the number of in-home care workers and their salaries.
Democrat and Republican voters, their great concern, almost as much as their children, is taking care of an elderly loved one who can't be left alone. Medicaid contemplated it, but this plan is going to help those families and create jobs for our caregivers with better wages and better benefits.
Brian Weinstein is with Visiting Angels, one of America's largest home care providers.
By 2030, all baby boomers will be at retirement age, i.e. 65 or above. So we'll have more seniors than we do children for the first time in our country's history.
Eventually, most seniors will need help with everyday tasks like bathing, cooking, and taking medications. Right now, 53 million seniors and disabled people get the help they need at home from relatives. This adds up to an average of 24 hours each week of care, plus a cost of $7,000 out of pocket each year, to say nothing of the emotional toll. Aside from family, professional home care providers are paid different ways, such as with private long-term insurance, VA benefits, personal savings, and in some cases, Medicaid. The government-funded senior health insurance program known as Medicare, however, provides very little for in-home care, and the Biden plan appears to keep it that way.
If you use Medicaid, it's a whole nother model. You have to redo all of your paperwork. You've got to send in and get your applications to make sure that you're eligible for Medicaid. If it was put into the Medicare program, I think it would be much easier for seniors to navigate for home care-based service through the Medicare program versus Medicaid.
In addition to shutting out people who don't qualify for Medicaid, critics argue in-home care doesn't fit the traditional definition of infrastructure.
I think it's going to be a real fight in Congress because what he's calling for is a $400 billion increase in spending in Medicaid. And Medicaid right now is spending about $130 billion a year on long-term care services.
Details determine everything, and so far, this plan lacks specifics.
I think it fits with a general pattern of the Biden administration's health policy, which is to piece by piece, step by step, expand direct government control over healthcare financing, the coverage of healthcare services and long-term care services.
So while it's clear America's disabled and low-income seniors need help at home, it remains to be seen whether Congress sees fit to spend hundreds of billions more on top of what the government already provides. Lori Johnson, CBN News.
Gordon, Lori's report highlights an important issue for so many American families.
Well, this is not just an important issue for American families. It's an important issue for our overall culture. What are we doing with people as they age? Let me give you some facts. The assisted living, the average yearly cost to have someone live in assisted living is $50,000 a year. When you step that up to a nursing care facility, that comes in at $100,000 a year. So wouldn't it be much better to provide for care in the home? Now, in the middle of a pandemic, does anyone want to go into assisted living? Does anyone want to go into nursing care? I think the answer is quite clearly no. Are you going to be more at risk in that kind of housing to contract the COVID-19 virus? So Why shouldn't the government come in and say, well, how can we change not Medicaid, which has an asset test? If you have so much in assets, you're not eligible for that. But why can't they change Medicare to actually help American families and help our culture so that instead of populating nursing homes and assisted living facilities, we're allowing people to stay in their own homes, and we're providing either the infrequent nursing care where a nurse will come to the residence, or you're providing for healthcare providers to assist them to be able to stay in their home and thus reduce the overall cost. As long as Medicare doesn't pay for that, it pays for a very limited amount of assisted living, very limited amount of nursing care. You literally have to strip out all your assets in order to provide, get eligible for Medicaid. And so people are trying to game the system to figure out which way to go. It would be much better to have one set of rules, and one set of rules that helps people and helps people stay in their own homes as long as possible. In the long run, it'll actually be cheaper for all of us.